Yesterday was World Diabetes Day, a global effort to raise awareness about the disease. But how can we strive for a healthier, diabetes-free world for all? Joining us today via Zoom is St. Luke's Medical Center endocrinologist, Dr. Monica Therese Cating-Cabral. Welcome to New Day, Dr. Monica.
Good morning, and thank you for having me today.
Thank you for being here with us. Now, diabetes is such an important disease, but why should we be aware of diabetes, especially those na baka magsabing wala naman sa lahi namin ng diabetes, or they're not even diagnosed, or they don't know anyone with diabetes? Why is it significant to be aware of diabetes?
Well, diabetes is actually fairly common among Asians, and that includes us. And sometimes diabetes, you don't know you have it until you actually get tested for it, because it's really something that you don't really feel until you have complications. And the complications can only come, 10, 15 years later after you've been diagnosed. So if you have family members or risk factors for diabetes, like you're obese, or you've had something called polycystic ovarian syndrome, or if you are a woman who's had a child and during that pregnancy you had gestational diabetes, these are some of the risks that really come about, and you might have developed diabetes in the next 5 to 10 years. So complications include eye problems, heart attacks, stroke. It can affect your kidneys. The whole body really is affected by diabetes if it's undiagnosed and uncontrolled.
That's right. So in short, it can happen to anyone. And like what you said, the complications are really significant and can affect someone's quality of life. Now, Dr. Monica, can you give us an overview of the landscape of diabetes dito sa Pilipinas? How common is it, like what you said?
Well, depending on the test, the latest survey says that it can be anywhere from about 7 to 12%, or just say about 4 million Filipinos have diabetes, and it's divided into type 1 and type 2 diabetes. So type 1 diabetes, these are patients who absolutely need insulin. They cannot live without insulin, and insulin is the hormone that you make to control blood sugar levels and to store it properly in the body. They don't have any insulin, so they have to inject all the time. Now, type 2 diabetes, you can use tablets or you can use insulin, but this is also a type of condition where your blood glucose levels just aren't controlled, even if you have insulin, but maybe you don't have enough or you're not using it. So this is why we really need to identify which patients have one or the other, and we need to treat them early.
Now, whether it be type 1 or type 2 diabetes, why is it common among Filipinos? Is it something to do with the lifestyle ng Filipinos? Diet ba ito? Lack of exercise ng culture natin?
It has to do something with genetics as well. The way our bodies are made compared to other nationalities, for example. We have something more called visceral fat. It's the fat that's inside the body. You can't see that. And sometimes that's the one that predisposes us more towards it. It's not really the diet. There are a lot of rice eaters out there as well. And just because we eat rice doesn't mean it makes us diabetic. But again, genetics has something to play with it. And lifestyle, of course, all over the world, things are changing. I mean, you're showing, people exercising right now and people eating, but are these the more common things? We don't exercise as much. We have bad diets now. It's so much easier to just order food and eat fast food. So that's why the obesity pandemic is also driving this increase in number of patients with diabetes.
That's interesting that you mentioned that diet isn't the main driver for someone to have diabetes, but a big factor of that is genetics. Maraming Filipino, syempre, mahilig sa matatamis, and ang matatamis ang associated dun sa notion of having diabetes. Let's set the record straight. What can you say about this, Dr. Monica?
Siyempre, kung mas mataas yung calories, mas matamis siya, mas mataas ang glucose level na, no? So if you eat more, you really will get more glucose from that. Everything we eat becomes glucose, whether it's meat, rice, sweets. But of course, if it's already sweet to begin with, or things like juice, liquid calories, even fruit, that's a lot of sugar right there. So amount and also matters, quantity, not just the quality. So if you're drinking soda, for sure your glucose levels are going up really, really fast. But if you drink, for example, juice, goes up not as fast as with the soda, for example, but still these contain a lot of glucose, a lot of sugar. So it's better to eat whole foods, vegetables, whole fruits, but again, everything in moderation.
Okay, keyword there is in moderation. Now, Doktora, a very important part here, how will someone know? Ano yung mga symptoms nito? What are the early signs that may point that they should have themselves checked with an endocrinologist? It could be a sign of early onset diabetes.
So, like I said, no, some don't feel anything, but maybe one early sign is after you eat something that is sugary or high calorie, you get dizzy. That might mean that your glucose levels are going up. When it's really more severe, patients really usually feel very hungry. They keep eating, but they're losing weight. No? So that's actually a sign of uncontrolled diabetes. Or always being thirsty. And since you're always thirsty, you keep on drinking and then you keep on going to the bathroom to urinate. Those are other signs also of uncontrolled diabetes. But you don't have to wait for those signs to show up. If you have family history, a parent, a sibling, a close relative who has diabetes, get yourself checked. If you are overweight or obese, get yourself checked as well. It's not a bad idea to get these tests done once a year, especially if you think you're high risk. So, in other words, if you're not sure, just go see your doctor.
That's right. So don't wait for the signs to come out. Have yourself checked with your endocrinologist as soon as possible. We definitely learned a lot today about diabetes. Thank you so much, Dr. Monica, for joining us here on New Day.
Thank you. Good morning.